My name is Dr. Zenas Yiu, and I am a clinical senior lecturer based at the University of Manchester in the United Kingdom, and I'm an honorary consultant dermatologist based at Salford Royal Hospital. So I think AI has fundamentally changed all of our lives in health, medicine, as well as our daily living. We can see that in the studies that especially AI that affects visual performance, they are performing to the level or even better than dermatologists, especially in the recognition of skin cancer and skin lesions. However, I think when we translate that into clinical practice, we still see an implementation gap. So our fundamental work hasn't really changed very much. We don't really have good evidence that using AI can really change patient outcomes. So there may be things like mortality, morbidity, maybe number needed to biopsy, and also the actual patient experience through using the AI. And we need more studies to be able to tell us and to be able to really be sure to integrate AI into our clinical practice and to know that it is doing our patients benefit and not harm. And that's a really good question. And I think it depends on what the AI tool is designed to do. If the AI tool is designed to help our clinical workflows or efficiencies, I think the bar is potentially a bit lower in terms of the evidence that we need, but we probably need more in terms of regulation and to understand, for example, the governance of where data goes and whether, for example, the data is protected for if we use AI scribes to help us in clinical practice. However, when we talk about AI tools that introduce an intervention, so that may be something that directly can direct patient care, we must demand a higher level of evidence. So as you alluded to, I think we should treat this like any other piece of evidence and any other drug. We should demand a high level of evidence that may be randomized controlled trials and in the future systematic reviews as well. And we must ensure that we get this evidence to be aware and also to be sure that these technologies will improve the outcomes that we're concerned about.